Good morning and welcome to the AdventHealth News Briefing. I'm Tom Johnson from AdventHealth TV. We appreciate you waiting an extra few minutes with us as we solve some technical issues. This morning, an update on the latest COVID-19 surge and the impact of the Omicron variant. Our guest today is Dr. Vincent Hsu. Good to see you again. He is AdventHealth's Executive Director of Infection Prevention and an epidemiologist. As always, we'd love to answer your questions. You can ask them in the comments section here on Facebook or text us at 407-490-3075. Again, 407-490-3075. And now is the time to start sending in your questions. A reminder for the media, if you have questions on topics other than what we were talking about this morning, we're happy to help you with that, but please send those to the AdventHealth External Communications team. All right, Dr. Hsu, let's start with our current census. There are about 630 people hospitalized across the AdventHealth Central Florida division with COVID-19 right now. That is still less than half of the peak that we saw during the Delta surge in August. So how is this latest increase affecting hospital operations?
Thank you, Tom. We are managing at this point pretty well. With the current surge. We recognize that this is still a surge that is rising, so we have to continue to remain vigilant and make sure that we have all the resources necessary to take care, which we do right now. I think the one thing we do have to recognize is that just like Delta, the limiting factor with taking care of patients is our staff. And we have seen a greater number of staff members that have come down with COVID that are not able to work, and because of those issues, we are really managing the staff as carefully as possible so as to manage the increasing numbers, and that's really our greatest challenge right now.
So the Omicron variant is thought to be milder than previous strains like Delta. What are we seeing inside the hospitals?
So what we're seeing in the hospitals are, again, many people are in there with primary COVID. They have shortness of breath, they have cough, they've got low oxygen saturations. That's still what we're seeing. Now, we are not seeing as many proportionally in the ICU, and that's good news. But I want to stress very closely that Omicron, while it may be a little milder variant, is still a very serious virus to be reckoned with. It is not the common cold. You don't see people hospitalized on ventilators in the ICU for common colds, but with Omicron, even though it may not be as virulent or as severe as the Delta variant, can still cause significant disease, hospitalizations. No one wants to be hospitalized. So as a result, we want to make sure that we treat this virus very seriously.
Are you seeing a difference between vaccinated and unvaccinated patients in terms of whether they develop severe COVID-19 or remain mild?
We are. We're still seeing that. Difference, even though we recognize that vaccinations are somewhat less protective against the Omicron variant, and that's why the boosters are so important to get that level of antibody up. We are seeing that the serious illnesses are largely still among those that are unvaccinated. So getting vaccinated and getting that booster, if you haven't gotten that booster, critically important to reduce the risk of severe hospitalizations and having to be on a ventilator.
Are we seeing any kind of increase in the number of children hospitalized with COVID-19? And what do you advise as schools resume classes this week?
We are seeing a greater number of children being hospitalized. It is approaching where we were with Delta, and yet, as you know, with the adults, we're not as high as toward the Delta peak as we were. But with children, it's probably because of just the sheer number of infections that have occurred. So the patients that we have in the hospital, in the children's hospital, are in for COVID-related illnesses. They may have chronic pre-existing illnesses, lung disease, for example. COVID adds that extra punch that lands them in the hospital. So again, we want kids to be very careful. My recommendation as an epidemiologist, as an infectious disease expert, is that we should keep masks on our children at all times while in school. I recognize that is not this landscape that we're in right now, but we want to encourage every child to wear their masks.
Well, and of course, If you're tuning in, this is your first time watching us, you may be thinking to yourself, well, you guys don't have your masks on. We've got them close by. Dr. Hsu has his with him. As soon as we're off of here, we will have them back on, and we are appropriately socially distanced. So we're always thinking about this. Don't forget the phone number to text your questions for Dr. Hsu, 407-490-3075. 407-490-3075. And Dr. Hsu, we do have our first question for you. Comes from Nikki with the Daytona Beach News Journal, who asks, how many children are hospitalized with COVID-19 at your hospitals? How sick are those children? And are you seeing more children than the previous surges?
Yeah, I don't have the exact hospitalization numbers this morning. I can say that relative to the Delta surge, we are seeing a number of hospitalizations that's approaching the Delta surge. So a little bit earlier in the pandemic, a greater number of hospitalizations just partly because there were just such a large number of the population, including children, that are affected. But what we're hearing is that we don't see a significant number of ICU cases or ventilated children. And again, even though they're milder, I want to stress that just being in the hospital is not a good thing. We want to treat this virus with respect and do everything we can to make sure that we don't get that. So getting vaccinated, especially now that it's authorized for children, we want to encourage them to get that.
I have another question from the media. This comes from Fox 35. Are there COVID patients in the hospital who were admitted initially for other reasons and then tested positive once in the hospital?
Yeah, so we do have patients that are what we call incidental COVID. They may be in for some other reason and then they test positive in hospitals, and that is really something that we would expect just given the numbers that are out there. But we also have to remember that it is possible that even though COVID wasn't initially suspected, there could be that extra punch in which the hospitalizations were caused or in which COVID contributed to that. So a good example would be someone that comes in with a heart attack or stroke. We do know that COVID is a very inflammatory virus that can precipitate those type of issues. So if someone comes in with a heart attack and then they test later for COVID, it could have been COVID that precipitated that heart attack. So there could be a relationship. So drawing all the conclusions, whether it was related to COVID or not COVID, isn't always that clear.
I have another question for you. This one comes from Facebook. Other than masking and vaccinations, are there additional early treatment recommendations?
Yeah, so from a treatment standpoint, one of the things that we have recognized with the Omicron variant is that it is less effective to use the usual monoclonal antibodies. So there's 3 monoclonal antibodies that are usually given. The only one that really appears to be effective against is called sotrovimab, but the Regeneron, the REGEN-COV, and the bamlanivimab etesevimab is not thought to be effective against the Omicron variant. Unfortunately, sotrovimab is in very short supply throughout the entire nation. So we want to, so in this case, it is really important to emphasize avoidance, vaccinations, social distancing, masking, especially if someone is at risk.
Another question for you. This one coming in on our text line. My husband and I are boosted and our 7-year-old is fully vaccinated. How safe is it to send her back to school and for us to do normal family activities? Should we be staying home?
These are questions that all families have to deal with, is what can we do safely? I commend you because you've done everything you can from a vaccination standpoint, and yet you want to be able to live your normal lives. We recognize the importance of school for your child, and so you can't eliminate risk completely. We have to recognize that unless you are at home all the time, you're going to have a risk, but you're keeping it as low as possible. I would say continue doing what you can, wear your masks, keep social distancing as possible, and actually the type of mask you wear is also very important. We recognize that the KN95s that are now widely available, or using double mask, a cloth plus a surgical mask, can add added protection than just a regular a single mask alone. So take those precautions if you go out in public, and of course we would recommend that you avoid large, tight-knit crowds, indoor spaces. That just only increases your risk.
Caroline Catherman from the Orlando Sentinel asks, what % of hospitalized patients are unvaccinated?
Right now, the number of hospitalized patients with COVID that are unvaccinated is a little bit higher than we have seen in the past. It's about 33-34%. And so while we recognize that the effects of vaccination aren't quite as significant in preventing COVID hospitalizations, this really still underscores the fact that vaccinations still are a very important part in reducing the risks of COVID-related hospitalizations. Get fully vaccinated, and if it's been 5 months now, the FDA authorization now allows you to get vaccinated as soon as 5 months after you're fully vaccinated to get that booster dose. Take advantage of that, because doing so will increase your antibody levels and provide additional protection.
Let's stick with talking about the vaccine for a minute. We have a question from Facebook. Do you think a second booster will be needed and recommended? If so, how soon?
So right now, there is talk about a fourth, what they call a fourth dose or a second booster dose. We know that there are some countries such as Israel that have started that, and they have seen increases in antibody titers as a result of that fourth dose. I don't want to speak ahead of what our federal authorities and public health authorities are saying, but it does appear that with every iteration of wave that occurs, and with the fact that we know that that vaccinations overall wane over time, we probably will have the opportunity very soon to have additional booster doses.
So safe to say it's at least being considered at this point.
It is. We have to consider that as an additional tool to keep the population as protected as possible.
Noah Hertz from the West Volusia Beacon asks, is there any talk of deferring elective surgeries in the AdventHealth system due to the rising COVID census?
Yeah, so there's always discussion about what we need to do. We have a command center in Central Florida. Every day they look at where is our status, what do we need to do, how is our staffing, and yes, elective surgeries or deferring that is always considered as part of that. At this point, we remain in green status. At this point, there's no imminent decision being made about deferring elective surgeries at this point, but it's always on the table. We are going to see what happens, and we've got very good folks at our leadership level who are constantly evaluating this.
The COVID-19 positivity rate at AdventHealth Centricare urgent care clinics across Florida continues to reach new highs, recently hitting near 40%. First, what does that mean, and especially to you when you hear that? And also, are there any signs yet that we may be at the peak of this surge?
Yeah, 40% positivity rate is extremely high. That basically means that 4 out of 10 patients who present with potential symptoms or even may not have symptoms are testing positive. And ideally, to get an epidemic under control, you would like to see that as low as possible, clearly as low as 5% or even lower than that. So 40% is very high, and it's the highest number we've seen since the start of the pandemic. Right now, with the Centricare numbers, with what we're seeing in the community, we have not hit our peak. We are still on the rise right now, but we are seeing it quite steep. And usually when you have a steep curve like this, it does mean that at some point when you hit that peak, the numbers will go down. When we look at at the data that comes from countries that have had Omicron earlier, a good example would be South Africa. It took about a good 30 days or at least a month from the time they really started rising up before they hit their peak. Central Florida, we started our surge somewhere around mid-December. So a lot of us are looking and saying, well, we probably are in another couple of weeks until we hit mid-January. Hopefully by that time we will start seeing a decrease, but it's really hard to make predictions at this time.
With South Africa, I believe, and correct me if I'm wrong, that once they hit the peak, the drop-off was fairly dramatic. It was also steep. Can we in the U.S. take anything from that, or is it a completely different situation here?
You know, there are some things there are some things we can certainly take back from what we've learned. I mean, certainly as we are using a forest fire's analogy, if a forest fire that burns very quickly and has no more timber to burn dies out pretty quickly, and that's what we saw in South Africa. But we have to recognize that the demographics here in Central Florida are very different than that of South Africa as well. We do have a larger number of folks that are elderly, those that are immune compromised. So we certainly can't draw a fast conclusion that, well, because there weren't significant hospitalizations in a different country, that doesn't occur here, because we do have more vulnerable population here in the U.S. and in Central Florida. We want to do everything we can to protect our population.
I have a question from Facebook for you. Should people who are asymptomatic get COVID testing before socializing with people outside of their bubble?
You know, that is really that's a great question, and yes, testing is an option to definitely assess whether a person is infected or not. It's not 100%, but it can certainly provide that security to get tested, even if you're asymptomatic. I will say, however, that tests are in short supply. And so testing persons who have not had a risk factor, or just to know what your status is, when you're dealing with short supply, that testing indication is probably a little bit lower, because you've got a ton of people who need to get tested because they're symptomatic, or they were already exposed, or they need it to go to their work. So I would say we should use our testing as carefully as possible, but certainly, yes. I mean, if there is a large get-together and a need to really ensure that people are negative, that would be an appropriate use for testing.
So where should people go for a test? And also, when should they come to or avoid the emergency room?
Yeah, testing right now is tough. It's hard to find over-the-counter kits at pharmacies. We've seen long lines at Orange County, for example, hours of wait to get testing. The central cares, require appointments, and the waits can be quite long. So, as far as getting tested, we encourage you to use whatever sources you have available to get tested. But we certainly want to make it very clear: please do not come to the emergency departments to get tested if you have only mild illnesses, or if it's not thought that there's any treatment that you're going to need. The EDs are swamped. And we want to reserve the EDs for those that really need it. If, of course, you have symptoms that require treatment, oxygen, you may need steroids, monoclonal antibodies, or other therapies, it's appropriate to go to the ED because you need to get treatment. You have some sort of respiratory or acute illness that requires medical attention. But otherwise, we ask that you do not use the EDs for that purpose.
Gary White from the Ledger in Lakeland asks, if the current trend of cases continues, is there a risk that hospitals will be overwhelmed?
There is always the risk that Omicron could be infecting a greater number of people than that will overwhelm the healthcare system. We have not seen that in Florida. I think part of the good news is that we had such a significant Delta wave that there is likely immunity from that wave that perhaps has prevented people from getting so sick and requiring the hospital. But there's always that risk. We always want to be prepared for that. We're not taking anything to chance.
We know, and I believe you mentioned it earlier, that hospital staffing is stretched here and across the nation. What can people do to support healthcare workers right now?
The simple answer, although I recognize I want to clarify that, is don't get infected. Avoiding getting ill certainly will then prevent the next step, which may be to go to the hospitals to seek treatment, especially if it gets worse. But But how do we do that? And again, that is really where it's important that we look at our own behaviors. And number one, in that is to get vaccinated if you haven't been vaccinated. If you've already been fully vaccinated, please get that booster dose. Please, the pandemic is not over. The virus doesn't care, about what we think. They only care. The virus only will jump to susceptible people. So wear your masks, and we talked about the importance of a good fitting mask or double masking. Just keeping your distance. And I recognize it is very hard for us to change our behaviors, and we're very tired. I'm very tired. You're very tired. But let's hang on there. At least get this surge, going down and over with. And if you can do what you can to prevent getting ill, that would certainly be the best thing for our healthcare providers and provide them some relief.
If you do get ill and you do develop COVID-19 infection during this current surge, should you still get the vaccine once you recover?
We're always going to recommend to get the vaccine, even after recovery. Getting that vaccine does provide the additional boost. Now, the timing may be, you don't have to get it immediately after having COVID. You could wait a little bit, but it is important to get that vaccine because we do know that it will boost your antibodies. And if you had to choose between getting repeated infections, which we know people have gotten infections after infection after infection after a period of time, because even after natural infection, your immunity does wane. It would make much more sense to get the vaccine, avoid that illness, and yet remain protected against COVID.
Because so many people are becoming infected right now, will this bring us any closer to herd immunity?
Yeah, the word herd immunity is really a tough one to answer because what we've recognized now with Omicron and with COVID is that you have different variations, you have different you have different mutations that occur, in which you're not provided complete protection against a variant that occurs. So this herd immunity is somewhat of a moving target because it may require repeated vaccinations, repeated infections to really get where we are. And then if the virus mutates again, that would put that herd immunity in question. So it's really difficult to say. One thing that we absolutely know now is that there is going to be another variant that's going to surface again. Now, what we would hope is that it will continue to be less virulent, perhaps not as infectious as previous, and hopefully what we have with our existing immunities with vaccinations and those that have gotten ill is that it would provide a measure of protection, I should say. But it may be very similar to what we see with influenza, where you just need to get a regular vaccine on a regular basis to help protect against the continuing wave of infections. And it's unfortunately an endemic. We're moving from pandemic to endemic, but what we want to try to do is continue to manage this where it doesn't affect our daily activities of living.
So that goes right into my next question. Is there a way to know if this might be the final surge of this pandemic before COVID-19 does settle into a more seasonal pattern?
There's not a way to know. We in epidemiology and infectious disease, understanding viruses, recognize that there is going to be another one. There's going to be another variant that occurs. There will likely be another surge. All we can hope for is that, again, based on, all we can hope for is that with the behaviors that we adopt, that with especially vaccinations, that we hope that any subsequent surge will be mild, not cause severe illness. And with Omicron, we're seeing that can occur. Perhaps future variants will be less virulent, will cause less severe disease. That would be great. It may become more like the common cold, but it remains to be seen. Right now, the best thing we can say is take action. There are things that you can do. Get vaccinated, get your booster, and hopefully that will be what we need to have a relatively normal life moving forward.
Dr. Hsu, always great to chat with you. Thank you for being with us today.
Thank you, Tom.
And thanks to all of you for joining us as well. Until next time, stay healthy and feel whole.